Nairobi is now ranked 6th among African cities whose populations are at high risk of being infected with the Covid-19. This is emerging even as government bureaucrats continue to allow in travelers from 18 high-risk cities in mainland China. For an update on this, let's cross live to our colleague Sarah Kimani from Nairobi in Kenya. Sarah, a very good morning to you as details come in of further continents that are being included in the areas affected by coronavirus. What's the latest in Kenya?
Well, the Kenyan government yesterday clarified and said that it would be wrong for them to ban any flights from China. But even as they said that Kenya Airways, the national carrier, remains grounded. They have not been going to China. They have not been going to Guangzhou, where they have previously operated 3 times a week. And so there is anger here in Kenya, especially among Kenyans on Twitter, among Kenyans on social media, and also among parents of children who are still stuck inside China. And they're saying that if the Kenyan government is allowing flights from China, then it would at this point allow their students from Wuhan who are stuck in Wuhan to come back to the country.
Similar concern in South Africa as the president yesterday announced a repatriation process about the efficacy of the quarantine process. What has been happening in Kenya in this regard?
Well, government has been saying that those who come in from China or countries that have already seen infections should be able to self-quarantine for 14 days. But this has been laughable for many people because they say the government is not in any way making follow-ups to ensure that indeed these people self-quarantine, or whether there are any follow-ups to see that these people are not infected once they leave the airport. And so they're saying that the chances of infection in Kenya are very high. But the Kenyan government remains saying that it has done everything and it has put all the measures of surveillance at the airport, and so it believes that the country is still safe. But there are other issues being raised. For example, the country has only 11 beds in the area that it has set as an isolation facility to be able to take care of any coronavirus infected patients who may finally be found in the country.
What kind of resources does Kenya have in terms of its responses, Sarah?
Well, there is a research institution, there is a referral hospital. One of the biggest in the East and Central African region is here in Nairobi. The research institution has actually been among those who have been training people from other countries in terms of surveillance. But when we spoke to people who work at the airlines or who work at the airport, they're saying those who have been trained are yet to come to the airport. They're also saying that the airport lacks enough equipment for proper surveillance. Incidentally, the equipment, the thermometers that are being used at the airport were actually donated by a corporate organization. So the government seems not very prepared. I've just told you that there are only 11 beds in the isolation facility here in the country. So, and these are the issues that are causing concerns among Kenyans that indeed, if the disease gets into the country, then putting it under control will be a problem.
All right, just give us an update in terms of any confirmed cases in the country.
Well, at the moment, we know that there are 2 patients from China who are actually under quarantine, and the government has just announced that they have heightened surveillance of these 2 because both of them are said to be ill. However, Kenya is very clear that at this point, it has none confirmed cases of coronavirus.
Sarah Kimani there talking to us from Nairobi in Kenya.